Yeah, okay. Can I undo the bra? So let's run quickly over a preparation. Again, I will do it faster than usual treatment. Start with really nice slow movement. Remember, the basics are always very important. Your posture. Yeah. So when I massage, I always think about kind of the brain of the client. How can I utilize the best therapy for them? So I don't just concentrate on the muscle, because the muscle has a boss. I need to talk to the boss. Yeah? So I will do some pet massage. Yeah? Let's say after pet massage, I will start with more like palpation deeper. Okay. Let's say I find, actually no, I want to show you something that is more universal, tender, and that's the infraspinatus muscle. Usually if you want to demonstrate in class what is a trigger point, the infraspinatus muscle is fairly good. So, can you bring Mr. White? Okay, so Mr. White, I'm going to show through him how do you get into the infraspinatus. So the infraspinatus is a muscle that's from here and it runs to the back of the humerus. So what I'm doing is palpating the lateral border, yeah, of the scapula, and then from there go a little bit in, and I'm there. Okay, so I'm on the lower angle. Yeah, I can feel the scapula, and if you kind of imagine this is the lateral border, how do? I feel it. So I feel that. Don't be very pokey when you're palpating. Then that's it. That's here, and I need to go over it a little bit. That's it. Okay, now I change. Okay, how is that?
It's okay.
Any tenderness?
Yeah.
Do you feel like the pain is diffusing anywhere or it's local?
I don't know. It's very peculiar. It feels like it's very local. It feels like it's in there.
In there?
Yeah, it feels in there.
Okay. So when it comes to a trigger point, try that. To some of you, you will have more like a pain you would feel maybe in front, maybe radiating to the arm. Yeah?
Yeah, it was actually.
Yeah. So again, you're coming to the lateral border of the scapula. Come from the lateral, not from the medial, just because it's easier to feel this muscle. Feel the base on your base of the wrist where it is, then change, and you're still palpating it, and then go over the ridge of that bone, and you're there. Once you're there, you might need to reinforce it. Yeah.
I can actually feel that down my forearm.
Onto your forearm.
The front, yeah.
Okay, so this is a sign of actually a trigger point, that you feel the pain actually here when I'm pressing here. Mm-hmm. Yeah, it's not that I'm pressed on the nerve, I just press enough, the brain starts to be kind of confused to where the pain is. Yeah, there are some more neurological reasons for that called convergence. If you want to learn more, then I'll be happy to direct you to. But now, what you're doing then, you don't press very hard. Again, you establish that kind of 7 out of 10 pain, and then you're getting slowly in. So tell me, how much pain is it now? If 0 is no pain and 10 is worse? 4. Okay, and now?
Yeah, it's about 7.
Okay, so I'm gonna stay here a little bit. If you can breathe in slowly and breathe out. So the way you're telling them, it's quite animative to the breathing. You can't just say breathe in, breathe out. you know, but just saying breathe in slowly, take a full lung of air, and then slowly breathe out. And while they do that, I slowly move it only a bit to whatever possible. Yeah? And what I'm doing, I'm trying to just reduce the stress, the tension there. Finish. Get into that area again. Okay. And then you can try again, etc. Okay? So as a therapy, as a manual therapy, there is not much difference. Yeah? What can be different, and that we're coming later to advanced technique, is actually take these treatment of compression and add another technique to it. And for me, advanced technique is actually doing two techniques together. For example, I would do mobilization, okay? So I will start mobilizing that and do that, the same compression, but with mobilization. Yeah? Do you feel anything, was it different? Was it better? Was it worse? Was it?
It was nicer with the mobilisation.
Okay. Why?
Because it, I don't know, the fluid movement sort of distracted my brain a little
Thank
bit
you.
from the pain.
Yeah. What you happen to do is that any movement would a bit distract them and not allowing them to contract their muscles. There is a tendency, you know, with a client to just hold it. So when you move it, you telling them a story. And the story is kind of the story of relaxation and how they can move, and you kind of do what you want and help, and then their brain relax. I went with my son to the dentist, and he needed to do an injection. So he was just distracting him, really. And funnily enough, he didn't feel anything. I mean, not even the first pass of the needle. So that's what we want to do. We don't want to just say, okay, take it. But how do you tell the story for the brain? They follow you, and then you do whatever you really need by pressing. Otherwise, it would be too much. Okay. Let's take another trigger point, say in Quadratus Lumborum. Okay. So it's the same thing. I actually use the opposite Quadratus Lumborum. I usually like to work on Quadratus Lumborum side lying. You know, it's really good, and look at the videos, but if you don't want to turn them just for that, then what are you doing? You're looking from here. And remember that the most superficial muscle is erectus spinae, and Quadratus Lumborum is below that. So you need to go and almost like feel the abdomen, and then you go a little bit backward and you're there. If you go too much backward, you are on the erectus spinae. Yeah, you're there. So this is erectus spinae. Okay. So I feel the abdomen because there is no resistance there. It's quite, yeah. And the first one is Quadratus Lumborum. Okay. So, is it tender here? No. Okay. So you can do that. Then, if you want to do mobilization a little bit, you need to do that, and then you rock the hip. You can do that, or if you want the opposite, you can rock the rest of the body. Yeah. Or you can do that and press the hip a little bit down. Okay. Shall we try? Try infraspinatus. Would be really good. And then Quadratus Lumborum. I want you to also palpate more, feel confident. And then see, some people would be nothing. Some people would be more. Depends. What's the issue? Okay?